I'm with Taylor Bradford from the Gloucester Daily Times. Hi, Taylor.
Hey, how's it going?
Good, good. And I would love to hear about two of your stories that were in today's paper, and you have updates also. So let's
Yeah.
start with masks. We have more people making masks.
So that seems to be the big thing that anybody who can get their hands on, a sewing machine, some cloth, the community members are really coming together to make them. But it really seems like the next level of mask making, especially for healthcare providers, has kind of topped out as the people at MasksOn, this nonprofit initiative, have been making masks over, I think they've made about 1,000. They're working to make 50,000 masks, making 1,000 masks a day for healthcare providers. And the big thing about these masks are they're reusable. So the cloth masks, while they're amazing and they're really awesome to kind of fashion and kind of protect yourself for those who are working within the hospitals, they don't seem to have the same effect because those healthcare providers need to be able to wash their equipment and reuse it, knowing it the next day that it's not contaminated. So they're using snorkel equipment to make these masks. And it's just incredible. I was able to speak with Sarah Remsen. She works at a technology company, and she's an alumni of MIT, and she heard about them and kind of what their work was doing, and so she decided to hop on board, and they've just been incredibly going every single day, kind of troubleshooting of what needs to be done, keeping up with the regulations and standards of the terminology of what different CDC and other organizations are producing. And while these aren't FDA approved, they're better than nothing. And healthcare providers are saying we need reusable masks. So why not use these? Because they're not only producing them, but they're also trying to fact check themselves to make sure that these are safe and usable for those who are kind of front lines in the field. So it's really incredible work that they're doing. And they have people all the way from MIT, other really well-established academia, and other hospitals just trying to provide hospitals like Brigham and Women's in Boston, really those things that they need in the front lines as they go to combat COVID-19. So it's really...
Well, and as I understood, there is the mask that a lot of us can walk around with here, the paper masks that hospital workers use, but the front lines people need something that's much more secure on their face that they can also breathe through. And that's why, I think the one in the hospital is called an N95 mask. And you can't make that with a sewing machine. You can't that kind of structure and breathability and yet security around your face. And these snorkel masks can do that, right?
Right. If you see the photo on our website and on MasksOn.org, they have it's a full face mask, and it kind of looks like something like a spaceship, like people going out into space. Really covers everything, and there's all these different parts that they've kind of put together to not only cover someone's face but also have a filter to ensure that there's limiting the bacteria that's coming in or viruses that are coming in. So it's pretty incredible. And for Sarah Remsen of Gloucester, her kind of focus too is trying to make sure and see, okay, how can we troubleshoot if these, like making sure they don't fall off someone's face, how are they going to be circulating the airflow as someone's breathing? They're not fogging up. So they're thinking about every single thing that might happen to these masks, how they can mitigate those to ensure that the healthcare providers can do their job and do it effectively.
And feel confident doing their job also. Yeah. No, it's really important work. So they have a GoFundMe page, I believe, right?
Yes. Yeah. So
GoFundMe?
MasksOn GoFundMe, and they've been doing about daily updates, if not every other day, of just kind of where they're at and how many masks they've provided. They're donations based only, so they're getting donations from people, organizations to help not only kind of ship off these masks, but also so all the equipment that they're getting is all donation based. And the coolest thing is when I was talking to Sarah Remsen, she said, this company's or nonprofit started in 7 days, and they have, and they're at a place where many nonprofits would have taken them decades. So it really shows that when people come together, they can do really amazing things and do it well and efficiently in a way that's going to really make effective change within our hospitals.
So true. So you have another great story, but a sad story. You want to talk about that?
Yeah. So unfortunately, Gloucester had its first death due to COVID-19. Filippo Zappa, who's 85 of Gloucester, passed away on April 5th at 9:11 a.m. in Beverly Hospital. And so he was a beloved man by many within the city. I was able to talk with his son, Peter Zappa, who owns the Causeway restaurant, and he was just speaking about how everybody loved him, how, you could find him at Cafe Cecilia, you could hear him laughing and smiling, and he always thought about others before himself. He's a retired fisherman and just really beloved by all within the city. So it's a really unfortunate loss, and one that I know is going to hit the community pretty hard. But it was pretty incredible to hear both from him and other people just kind of what they remember of Filippo and kind of his impact that he had on their lives. So I think it definitely shows that people who pass away from this really horrific disease will not be forgotten. Their legacy will really live on here in the city.
We all feel these losses. It's really feels nice to be in a community so close, but it's also, you feel the pain too. Yeah. So what are you working on now, Taylor?
Yeah, so kind of as I said earlier on this week is tonight's the big night, public hearing for the school's budget for the 2021 fiscal year. So I'll be sitting in on that virtually and listening to different community members and the school committee about kind of the budget and what's it going to look like for next year. So I'm actually very excited about that, to kind of see what people's conversations are. It's not all going to be around the coronavirus and what's being done with that, but I'm sure that will have an effect on kind of their forward thinking. And then they're also going to be looking at the superintendent search committee and updates to the school, just as they continue to think about going forward in not only this academic year, but also the following, because really our current situation will have an impact on us for the rest of our lives. And so how that looks and how that affects students is a big one. I know I live with many teachers actually, and it's really incredible to see the work that they're doing, every single day to ensure that their students are getting the knowledge that they need, working over hours, trying to figure out how to not only provide the best information, but also care for their students in any other ways that they need. So tonight will be a big night to kind of touch base and see, what the schools are doing to make sure students are able to continue learning this spring. So
it's going to be a big story.
Mm-hmm.
Thanks for doing that. And we look forward to catching up with that too.
Yeah, have a great day.
Okay, you too. Take care.
Bye.
Bye.